morning, good evening, and good afternoon.
And for today's hot topic,
Sports injury. Bam!
and we are
Feather Juicy Giants!
I want it all day long. I'm addicted like it's
What you gonna do with that dessert? Do what, dee da, dee da, dee da. Do what, do da, dee da, do da, dee da. Do what, do da, dee da, do da, dee da. Murder that, dance floor, dance floor.
Alright, let's do this.
Murder that. What you gonna do with that dessert? Do what, dee da, dee da, dee da. Do what, do da, dee da, do da, dee da. Do what, do da, dee da, do da. Murder that dance floor.
torn muscle and bone fracture. Very serious injuries, right? But this kid, he ignored it. He just put ice when he went home. Let's see after 2 years. Stupid. At this very moment, he could feel the pain in his legs. Right over here. Let's see what happens. Due to his previous injury, he ignored it. That's why his legs gave out. I'll explain to you why. Kuya Logbet's kneecap has been dislocated. It occurs when the triangle-shaped bone covering the knee, or called patella, moves or slides out of place. The problem usually occurs toward the outside of the leg. Suffering from dislocated kneecap is a serious, painful injury that needs immediate medical attention. Not seeking one may end up to long-term consequences that, of course, no one wants to endure. But since the pain is tolerable, Kuya Logbets ignored the pain. A partially dislocated kneecap is what he had, which doctors call subluxation. Can be a result of a previous dislocation or an inherited tendency for the kneecap to slide to the outside. The symptoms that may occur are the following. Knee appears to be deformed, knee is bent and cannot be straightened out. Kneecap or the patella dislocates to the outside of the knee. The first few times this occurs, you will feel pain and be unable to walk. However, if dislocations continue to occur and are untreated, you may feel less pain and have less immediate disability. This is the reason why Kuya Logbets ignored treatment and disregarded the fact that it may occur again in the future. But when he ran in a track and field contest 6 months later, he felt his legs gave out. Now the injury got worse. Kneecap dislocation damaged his knee joint, and now he is unable to walk. Swimming, a sport that requires stamina and muscle strength. Common injuries may occur at the external extremities, but little do we know that the inside parts are also in danger. Let me explain to you what happened to Manong Testi. What he has accumulated and what he developed is what you call swimmer's ear, or in medical terms, the otitis externa. What Manong Testi has is the otitis externa, or also called the swimmer's ear. It is a diffuse of inflammation of the external ear canal that may extend distally to the pinna and proximally to the tympanic membrane. Since he ignored it, it evolved into the acute otitis externa. It is a common condition involving inflammation of the ear canal. The acute form is caused primarily by the bacterial infection with the Pseudomonas aeruginosa and Staphylococcus aureus, the most common pathogens. Common treatment for this kind of infection are antibiotic drops, like corticosteroid. If not prevented and not treated at a very early stage, the temporary loss of hearing may become permanent in the side of the damaged ear. The first sign of symptoms that a patient may feel is as simple as an itch, or maybe his or her ear will feel a little bit full. The next sign of symptoms a patient will feel is that the ear canal will start to swell, and then ear drainage will follow. At this very moment, the pain will start to feel pain. At this very moment, the patient will experience extreme pain due to the infection of his tympanic membrane that will hinder him to move his mandibles or jaw. Just like with dog vets, mouth tests ignore the symptoms that they are experiencing. That's why this disease became worse and the damages became more severe. That's why you need to keep yourself checked, because prevention is better than cure.